Grief is messy, and I'm no maid. This is Every Widow Thing.
This episode is brought to you in part by Meredith Schlosser, expert real estate agent in the Los Angeles area. And whether you're looking to sell or buy or want a great recommendation for agents all over the world, she's got you.
Today's episode is brought to you by Roger Brooks and his team at Strategic Investment Management. As an Austin-based fiduciary financial advisory firm, Roger and his team bring decades of experience and empathy to help people regain financial control through life's ups and downs so you can move forward with confidence.
Welcome to Every Widow Thing. I'm so excited about our guest today. I'd like to welcome Shieva Ghofrany. She is an OBGYN for over 25 years, you guys, so she knows her shit. And she's also the co-founder of Tribe Called V. It's a virtual platform that speaks openly and honestly about women's health. She's a tireless advocate for women, but really for people, and has a wealth of knowledge. So we're so excited for her to be here today. The reason we asked her is because we want to talk about sex and sex health. And she knows everything, and there is no topic that is taboo for her. So thank you so much, Shieva, for being here.
Honey, thank you. First of all, thank you for the intro. And I love that we're going to talk about this. And I would say it applies certainly for people who are embarking on sex again after having been widowed, but also people who are just postmenopausal or perimenopausal and haven't been in the game for a while because marriage, all of it. So it applies to
Exactly.
so many of us,
This
right?
episode is literally for anyone that has been out of the game for a little while. And even like you said, premenopausal, menopausal, because our bodies are changing and we don't really know what's going on. And there's a ton of information out there, but it's different than the information we got 10 years ago. You know, Holly and I, we've been with our guys since we were 19. So when we were all of a sudden pushed back into the game in our 40s, that's a very different environment. So we're going to start with Holly. We asked our audience actually for questions. So we're going to be addressing some of the questions that they have, some of the questions that we have, and we're going to start it off with Holly.
Well, okay. So I decided to start dating 5 years after my husband died. And it was, we'd been together 28 years. And so I'm like, yay, I'm going to date. And everybody's all excited for me. And they're like, well, be careful of the STDs, STIs, herpes, blah, blah, blah. And I was like, I just want to go on a date.
This is one thing that I love about you and your Instagram. You address it a lot and try to normalize it. So let's talk about the STIs. It used to be STDs.
I know. I was like, STDs, STIs.
Right.
So
Well,
tell
do you
us
know why
what's
we
out there.
switched?
Because it's not
It's not a disease.
It's not a disease. Disease sounds so judgy and like, oh my God, like it's something terrible. Whereas what I always try to say about STI, sexually transmitted infections, is it's just a part of having sex. You have to accept that there are certain ones you can almost always avoid by doing certain things. And there are certain ones that you cannot 100% avoid. And you have to accept that risk. Or if that's too big a risk to accept, then you have to abstain, which most people don't want to do. And I hate to say that everyone has herpes because not everyone has it, but a huge portion of us have had it, have it, don't realize we have it. And if we can normalize it and more importantly, destigmatize it, then people will learn about it. They won't freak out. I actually have said millions of times, I think if people learn more about it and didn't freak out, we'd probably prevent more herpes because they would learn about it and they'd learn the strategies as to how to decrease it. Because they wouldn't be so embarrassed about it. They could talk about it more openly. In the 80s and 90s, there really was this campaign, herpes is forever, which, as I say to people all the time, technically speaking is true. Once you've been exposed to it, you have it. But like
so is chickenpox
is forever.
Exactly.
And we don't say chickenpox is forever. So it sounds so ominous and scary when we say herpes is forever. So that's unnecessary, right? Because the implication of that would be you want to try to avoid it because it's forever. But the honest answer is you cannot 100% avoid herpes no matter what, because even if you used condoms, dental dam, took medication to suppress it, and had your partner take medication to suppress it, you still theoretically could get exposed to the virus because so many of us carry it without knowing it, and we shed it. We say it sheds asymptomatically, meaning without an obvious cold sore on your mouth or on your genitals. So that's why you can't 100% avoid it. You'll drive yourself crazy by thinking you can. So then by ominously saying like it's forever is useless. I guess the only thing that I would tweak if I could, and I try to teach my patients this, is instead of saying like, I have herpes,
Right.
which again sounds like this, I wish we could all just change our vernacular and say, oh, I carry the herpes virus. Because many of us
Oh, that's
carry the herpes
good.
virus. And we would know it if we all got tested, but you guys might know this or you might not. The current guidelines by the CDC do not recommend screening for herpes. So when you go to your doctor and say, I want full STI screening, if they're just sticking with the guidelines, they'll test for HIV, hepatitis, syphilis. They will not test for herpes. They'll also test for gonorrhea and chlamydia and probably something called trichomonas. But herpes is not part of the screening. Unless you come in symptomatic or asking for the test, it's not standard. I have many feelings about that. I actually think that in order to destigmatize it, we should just kind of routinely screen everybody, anyone who's actually having sex, oral or otherwise, right?
Mhm.
And then we'd all know, and then we could destigmatize it. And we could kind of say like, oh, I've been exposed. I haven't been exposed. Oh, if I haven't been exposed, here are the things I could do to decrease my chances. I've been exposed, but I never get outbreaks. So my likelihood of shedding it asymptomatically might be less, but it might not. So let's talk about that. It would just be a conversation like it should be right now.
So let me ask you this. What is, in your experience, is herpes the most common?
The most common is actually HPV.
Okay,
So
and
human
we wanna talk about
papillomavirus,
that.
the one that causes warts or abnormal pap smears, is the most common because really 90% of us carry it.
Right.
Carry it. I don't like to say have it because again, that sounds so stigmatic.
So
we
question
carry.
about that. If you have an irregular pap, that means HPV, correct? Like when someone's
Almost always.
Okay.
There is a
Oh.
small percentage of the time that an irregular pap smear is not from HPV, but the vast majority of time,
okay.
like over 90% of the time, it is from HPV. And the vast majority of us who have had HPV or currently have it, whether or not we know it, will never have cervical cancer, oral cancer, or anal cancer, which is the cancers that can cause. That said, most of us, if we have had sex, even once with one partner with a condom or a dental dam, we'll get exposed to HPV because it lives on the skin very easily in our genital area and in our mouth and in our anus. And so that's why I say to patients, like, if you tell me you want to avoid herpes and HPV, I'm going to tell you not to have sex. Like
Right.
that's the only
Wow.
answer. But
Right.
then we can actually get a little bit fancier and say, okay, use condoms when you can, recognizing that you can still get either virus, even with condoms. Talk to your partners about whether or not they know they've been exposed. Again, now we're getting into more details, which are, Whitney, you had said, don't you know you have HSV, herpes, if you've had a blood test? And the answer is yes, but all you know from the blood test for herpes is that you've been exposed at some point and that you have antibodies. You can't tell when you've been exposed or who exposed you unless you've been routinely testing like every 6 to 12 months, and then you could time it. But like if
Right.
just today at age, I'm 54, if all of a sudden today I decide I'm just going to go cold test myself for herpes and I've never been tested before, and I show up with antibodies against the 1 or 2 strains of herpes that we test for, which is herpes 1 that usually causes cold sores, or herpes 2 that usually causes genital ulcers. If I test positive for both of those, I don't know, did I get it from the first guy I had sex with when I was 18 years old or the most recent person I had sex with, which is my husband, right?
Right.
And if I got it from my husband, who I've been with now for 25 years, did he give it to me during our marriage or prior? There's no way to know. So even herpes testing is confusing when it's positive because there are some false positives and because it's only telling you you've been exposed. It's not telling you timing. Again, unless you're going regularly, in which case you see certain changes in the antibodies show up.
Mm.
Does that make sense?
Yeah.
It's like with COVID, right? Like if you guys got tested for COVID, let's say you've never had COVID before and you got COVID testing right now for antibodies. You might all show up with antibodies unrelated to the vaccine, but you wouldn't know when you had COVID. I am going to offer you all, ladies who are embarking on sexual activity, try not to use those terms with yourselves
Right.
because then you're further scaring yourself or your partners, right? It shouldn't be a scare. It should be, I know, I get it. I always joke, like, I get that no one wants it. I don't want it either, but I don't want it to be a scare.
Well, I think
because
it's how we were brought up. I think it's that
Totally.
campaign when
Yeah.
we were younger.
Completely.
You know,
Yeah.
we don't feel dirty from having the chicken pox, but we feel dirty with having herpes, which, by the way, you can get from drinking after somebody. It doesn't have
Right.
to be
And-
sexual to get herpes.
Right.
It's just a different
Well,
herpes,
and so
but now it's all mixed up.
It's mixed up. And this is a common thing. Like I have been tested, right? Because I wanted to know and I wanted to like prove to my patients that like I'm like everybody else. And I tested positive for HSV1, which is the oral cold sore virus herpes, right? I was negative for HSV2, which is just dumb luck because it's not like I didn't have sex before, right? Now, what I tell people is this. I don't know if I got even the oral one from my mother, my best two friends, or my husband. They've all had cold sores. I'm lucky. I've never had a cold sore, but I carry the virus. If I gave someone oral sex, I could give them the virus on their genitals, even though it's oral cold sore virus herpes. I might not know it because I'm not shedding any virus. And then they end up with genital herpes from the oral virus strain. And now they're freaking out and think there's something terrible, when in reality, it was all very innocent, right?
Okay.
So again, common.
Well, so then for people out there that are like just embarking on intimacy for the first time in a very long time, what advice do you give them in this scenario? And then we still need to talk about HPV or in any of the scenarios.
All of them.
Yeah.
Okay. So let's say you came to me and you all said, okay, guess what? I want to start having sex with someone. I don't actually use the word intimate just because I don't know why I don't. I say, let's start having sex.
Because you're a doctor and you like medical terms.
I'm a doctor.
Intercourse.
Intercourse. Like, I don't know, intimacy sounds so beautiful, but it also is like, it sounds subtler.
No.
So I'm going to start having sex. What should I do? I would say first and foremost right now, let's get you tested, which in my practice would be HIV, hepatitis B and C, and syphilis for sure. Those are blood tests. Gonorrhea and chlamydia, which can be a genital swab or a urine test. And then I would also talk to you about herpes. And I would say, do you want to get tested or not? It's not the standard, but here are the reasons why I think you should, though you might not want to, because sometimes the knowledge does freak you out. And if you're not equipped to deal with that yet, then let's table it. And according to guidelines, you don't have to test for it. So we would talk about all those things, right? You might notice I didn't say HPV in that because there is no direct test for HPV other than having your pap smear. And with the pap smear nowadays, we test for HPV, but it doesn't tell us when you were exposed. It doesn't exactly tell us which strains you have specifically. It might, but it's not the standard of care. And you can have a negative test right now, and there's still potentially low level of HPV in your cervix or a previous history of HPV that is already cleared. So HPV is not part of the routine screening, but those other ones I mentioned are. So those ones are the ones I would test for. And I would tell you to do it so you have a baseline so that you know, like, do you carry any of these that you didn't know about? Let's know what your status is. And let's talk about it like calmly, but warmly, but in a way that is not going to freak you out or scare you, right? The second thing I would say to you is you are all of my generation-ish, right? We're all in our, I'm assuming you guys are like 40s to 50s. Mm-hmm. So we did not get vaccinated for HPV. Mm-hmm. And do you guys know this, that the guidelines now support getting vaccinated for the HPV virus that many of our children are getting vaccinated for, starting at around age 11 for boys and girls. But now they've extended it past age 26 to age 46.
Oh, wow.
So I would tell you to also get vaccinated for HPV, even
but
if
what if you already have it? It doesn't work then.
So Great question. No, it can work because just like with the COVID vaccine, when we got vaccinated for COVID, if we got vaccinated, it wasn't necessarily only one strain. It wasn't just Delta. It was also Omicron, for example, right? So when we have HPV, like I said before, we don't know exactly which strains we have. And there's actually probably hundreds of strains, but we've defined dozens of strains. The vaccine covers 9 strains. So even though, like in my case, I know I had HPV because I was 22. I had warts. I had an abnormal pap smear. I know I have HPV. I don't exactly know all the strains. So I could get vaccinated against the current 9 strains that we can vaccinate against so that I could prevent future exposure to HPV.
Oh, that's good to know.
We all missed
we missed
the 46 cutoff.
We missed that deadline, but our listeners haven't. Yeah.
Right. And here's what I will say, and don't quote me on it for your doctors, but you could quote me on it. Technically speaking, the guidelines only mean that it's FDA cleared for that purpose or FDA approved for that age group, and therefore insurance should cover it. You could elect to talk to your doctor and say, I know I'm past age 46, but can I still do the vaccine? And there's no harm in doing it. And the truth is, the biggest reason I would tell you all to do it is really not to prevent cervical cancer, because if you go routinely for your pap smear and get it done every 1 to 5 years, which is the current guidelines, you're likely not going to get cervical cancer, or certainly not advanced cervical cancer, but all of us are at risk for head and neck cancer. And that's on the rise because we can't screen for it the same way. So I really would tell you all, if you are going to go have sex with someone new who likely does not know his or her status with HPV, please consider getting vaccinated. And anyone out there listening, please, 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 if there's ever a reason to vaccinate your kids, like I in a hot second would want every kid to be
Oh
vaccinated.
yeah, I had
Again,
mine
less
done.
than
All of
cervical
mine.
cancer.
I've done all three of
All
mine.
of mine.
Yeah.
Okay, so this
Yeah.
is interesting because Lacey, you brought up HPV, and you were talking about the throat cancer.
Yeah, that seems
Yeah.
to be on the right. Michael Douglas, the actor, and I think
Yeah.
there's another
Oh,
actor
yeah.
that came out and said the one Val Kilmer,
Kilmer.
was another one, and so
I
that
didn't
was
even know that.
yeah. So I was
Yeah.
wondering.
Yeah, so it's on the rise. Absolutely.
So that
And
is
we know
specifically
that's
from
HPV?
HPV and oral sex. That is how you got that particular throat cancer.
And you can keep passing it back
Dang.
and forth between, if you're with a partner, even if one's cleared, you can keep passing it back and forth till, so it's interesting that
Well,
you say you could
yeah,
get the
It's
vaccine.
HPV it's a fascinating thing. HPV as a virus is like we could do 3 episodes on just HPV. HPV is a fascinating virus because we say that many of us get exposed and then we probably clear it, and it's the persistence of the virus that worries us. But the truth is, as OBGYNs, a lot of us anecdotally will tell you, like I've had patients who literally haven't had sex in 20 years, like nuns who had intercourse once and now we're nuns, not having any sex. And all of a sudden their pap smear showed up with HPV. So that was not new exposure. That was a virus that
So
stayed
we
in their
think.
system at low levels. And then
Those nuns. You got to watch out for those nuns.
those
Yeah,
nuns,
those
right, who
nuns.
knows? Right? I guess they could have been doing
That's
something.
crazy.
So I would
So what do you do? Because we talk, you are very much about, being proactive and not being, what's the word?
Afraid.
Yeah,
paranoid.
but it
I
starts
say-
with a P.
Oh, I say be proactive and not being paranoid.
Yes,
Yeah.
thank you.
Paranoid.
I'm just going to be frank here. Oral sex is a part of the relationship a lot of the times, and now I'm like scared to death.
Again.
Well, you should be.
So what do
And
you
you know
do?
what, you guys, seriously,
No, seriously,
really
what do you
important.
do?
I mean,
I don't want
this is
throat
the most
cancer.
Because the men
I
can't
know.
be
I don't either,
tested,
but-
correct?
Right.
this is my ubiquitous example every single time. And if you really think about it, I will guarantee you that if you're being rational, it will resonate. And I want you to keep going back to it. Every single day, I'm pretty sure all of us are getting into a car, right?
Right.
And every single day, we don't know it, but we have been taught this mental model that you're going to get into a car, but you're not going to be drunk. You're not going to text. You're going to wear a seatbelt. You probably have airbags. You have to get to work. You have to get to your podcast. You have to get to your friends at the bar. You have to do all the things you want to do. And therefore, you're not going to say, I don't want to get into a car because I don't want to get in a car accident and die.
Right.
You're going to say to yourself, I'm probably not going to die because I've taken all these measures. You're not even saying it consciously. It's so mentally modeled into your behavior. You're taking measures. You're being as cautious as you can, and you are accepting the small risk of either a fender bender or the even smaller risk of a catastrophic illness. A fiery crash, right? You're doing that. We're all doing it.
That was me.
It's the same thing.
Yeah, Keira actually was in one, and this is one of the things
It
that
happens.
Yeah, this is one of the things that we learned from another guest that we had on recently, where you can be fearful after you lose your spouse unexpectedly, which we all did. It can create fear and wanting to control every little thing in your life. But one of our guests, Tiffany from Rebuilding Joy, said, which was so true, we did everything right and he still died.
Yeah.
So you can't
Right.
live in that fear. You take all the precautions that you can and you go
Right.
live your life. Yeah.
Yeah.
So you're right.
And so you
It's
take,
true.
we do it every day. And the car is the best example I can give of us taking a measured risk every single day. That actually, some people do die, but the odds are small. So when it comes to oral sex or sex, you have to just kind of pragmatically look at it like that. Like, I would like to embark on a sex life. I know there are certain risks. What are the things I can do to minimize my risk? I can get vaccinated, whether or not I want to stick with the guidelines of only being in my 40s or not. I can make sure that I have a conversation with my partner about, do you know if you've been exposed or not? Do you know if you had genital warts? Do you know if your past partner had abnormal pap smears? And even then, by the way, all it is knowledge. It's not prevention. We don't have prevention yet outside of the vaccine. And then you accept that there can be some exposure, but it's worth the risk because I'm not going to
Unless
say
you
they
want to
all
be a
enjoy
nun
getting oral
and
sex,
not
but
have any sex.
No, even the nuns.
Then you want to go the
Even the
nun
nuns.
route.
If you've
even
never,
the nuns,
No
right?
sex.
even the nuns.
And then the secondary part is also recognizing like, okay, so then don't be paranoid. But if all of a sudden, let's just talk about like your throat, your voice changes and your throat gets raspier, you start to notice that it hurts when you swallow, you start to notice that you feel something, don't freak out and be paranoid and think you have cancer because you probably don't. But go to your doctor and or an ear, nose, throat doctor to look in your throat. I remember years ago, my voice was raspy and I was like, I went to my ENT and I was like, I know it. I know it. There's warts on in my vocal cords and I've got HPV there, don't I? And she was like, chill out, sister. You are fine. She's like, you have some polyps because you talk a lot and drink coffee. But again,
Well, then I'm on my
it's
way.
right? So I don't want any of you or anyone listening to think or even say, but now I'm so scared. I want you to think, oh, now I have knowledge. Now I
Right.
know how I can prevent it, that I can't 100% prevent it, and that I'm going to be proactive, just like I do every day with my car, right? Like I want
Excellent.
you to keep going back to that example because you do it. You've already been taught, but no one said to you when you were 16 and getting your license, by the way, well, actually my mother did, but your parents might not have.
I think
You
every
could die in
mother
a fiery crash
has this
every minute,
conversation.
right? They
Right.
would have scared the shit out of us.
Right. Exactly. No, every mother I think does
I
that.
just remember that in like Driver's Ed, there was that scary movie they would play.
Yeah.
And
Yeah,
it
the
was
crash
just crash
dummy.
over crash over
Yeah.
crash. And you were
Right.
like,
Yeah.
oh my God.
Yeah.
But
Yeah.
there's a lot that's
So-
not in our control. So what you're saying is you become knowledgeable, you prevent as much as you can, and then you go and you live your life, which is a great message for widows and widowers and anyone that's had loss, because after something traumatic like that, you can be very fearful. And
Yeah.
and
I
that
would
is not
imagine.
the way you want to live. All right. So,
No.
wow, we could keep talking about this, but we've got some other questions that we want to get to. So
Okay, wait, but I have two
Yes.
things that I want to say.
Yes,
one,
please.
one is just an adjunct. So when we said like, okay, what would you say if you came to me? And I would say, okay, let's talk about your STI panel. Let's talk about contraception. And then ideally you meet someone new. This is like my pie in the sky future world. Everyone kind of shows up with their like, hey, I like rosé, you like vodka. Here's my STD screen. Let me see yours so that we can like match. Like, oh, look, we've both been exposed to both herpes. Therefore, we're not going to give it back and forth to each other. Check. That one's off the list. Oh, it turns out I had HPV. You did not, or you don't know if you did because you're a man and you don't get tested for it. We're going to use condoms for a while until we decide that it's worth the risk of not using condoms and then move on. Or I had chlamydia, but my chlamydia now is negative and I was treated with antibiotics, right? So you can kind of go through that checklist together in a non-emotional, non-judgmental, non-stigmatized way,
Mhm.
because you're just trying to figure out like what level of concern do I need to bring to the table here?
It's important to have those conversations with someone. I don't know why. It's like finances. Why at a certain point,
Right.
if you're going to have sex with
Yeah.
someone, doesn't it make sense that you should be able to talk about money? Not politics, but you can talk about money and you can talk about sex and
Right.
talk about as
Yes.
long as you do it the way you do it, which is in a non-judgmental way, but in a mature way.
And we're still in this weirdly
Embarrassed.
puritanistic society where like
Yeah.
everything, we're hypersexualized, but we're like, oh, let's not talk about sex. Even
Right.
though like every other thing on TikTok, Instagram, music, videos is about sex,
Right.
but it's not really about sex.
Right.
It's really messed up.
So you would say
Yeah.
to someone, like if we're talking to our audience of widow and widowers, or even, we have some people who are divorced, solo parents, whatever it is, and they're ready to get back out there, the first thing they should do is go and get tested themselves so that when they have a partner, they can say, I've been tested, this is what we're working with. And really,
Right.
I feel like you should have that conversation as if you've been on a couple of dates and you think this is what you want and you want to go a little further, then you have that conversation of, hey, I've been tested. I'd like for you to be tested. And then you both show your tests.
Yeah.
It's like a test reveal, and then you take
Yeah.
your clothes off.
And I think that's so hard because like, you
And
want
it
to
is hard.
go ahead. Sorry. I was going
No,
to
you
say
go
you
ahead.
want to get that taken care of before you're in the moment.
Right.
Especially if you've
Yeah.
been out of the game for a minute and you're getting carried away.
And it takes a few days.
You've had a couple drinks and it's like,
Yeah.
it's on.
Hey guys, Whitney here, and I'm about to share some information with you that can make a very stressful situation super, super easy. Talking about buying or selling a home. I have the perfect realtor for you. Her name is Meredith Slosser. She's a real estate agent based out of LA, but she has teams all over the world. So if you're not in the LA area, you can still give Meredith a call and she can put you in the hands of an expert. Here's the deal, all right? You want to work with someone who is knowledgeable, dedicated, trustworthy, and also a good person. You're going to be spending a lot of time with him. I was able to work with Meredith when Hunter and I were moving to Austin. She handled every portion of the sale of our home. Client satisfaction takes precedent over the transaction, if you know what I mean. Her website is meredithslosser.com. Her info will be up on our Every Widow Thing Instagram highlight reel under sponsors. And if you do end up calling Meredith or reaching out to her, please let her know that you heard it here on Every Widow Thing. And now, back to the episode.
Imagine a financial partner who meets you exactly where you are, acknowledging your grief and taking the time to listen, empathize, and truly understand what matters to you. Strategic Investment Management can help you plan a course that honors your past while embracing your future. Whether you're worried about tax implications, paying off debt, or stewarding your asset distributions, Roger's team can make a plan that's aligned with your family's needs and goals. For more information, visit www.strategicim.com or give them a call at 512-341-9898. Again, that's 512-341-9898. Tell them you heard about them on Every Widow Thing. Can we shift gears?
Yeah, well, yeah. Yeah, we've got,
Lot
we
to
need
cover.
This I'm
We've
dying
got
to ask
so
you
much.
so much because I follow you and you've run the gamut with all these topics. Whitney said something one time and it cracked me up because it's so true. We've all lost our husbands in our 40s. And so you're getting back out there and you remember, I didn't get married till later in life, but I was 36 when I met him. So married at 37, almost 37. Well, I looked a whole lot better then and things were a little higher, a little, and now you've had babies. And so my 19-year-old butt, he doesn't know my 19-year-old butt.
Yeah.
So that said, a lot of us are trying to do things to look a little better, get our hair done. And the one thing, Ozempic, all the other drugs that are doing the same thing that Ozempic does, and I have a lot of friends that are on it, I have been very fearful of it because I had an uncle who died of this heart issue from fen-phen. So that's been my fear of trying it, even though it would be nice because, as you know, not that you've experienced it, I don't know, but menopause, you can gain weight. Like I'm bigger now than I've ever been.
Well, honey.
So it's frustrating.
Okay, again, you guys are good. You guys are good because your 1-2 questions brings up like 10 things. So
I know.
I think
I'm sure we could do a whole episode on semaglutide. Yeah. Asking for a friend.
I
It's about Ozempic.
I say very publicly and very openly that I had weight loss surgery when I was 40. So I am leaner now at 54 than I was from 30 to 40, but that's only because of weight loss surgery and Ozempic. So I get it. Second, I would say this. I laugh when I think of us as women that we're like, oh my God, my butt when I was 19 was not that great anyway, but like my butt wasn't what it was when I was 19. Like how many guys out there have like the fucking abs they had when they were 19?
Well,
Yet we're
it's
worried
so
about
true.
what
They're
harder
so
on
critical.
us. They're
About
harder
that
on us
bad
though
now.
than we are on them, I think.
We are
mean,
so critical of ourselves.
really? That
that's
said, I get
that's
it.
the difference. Yeah.
Right. But okay, so let's tease apart. Fen-phen, which by the way, of course, I tried that in the 80s too, because I tried all the things because I had such disordered eating as like a girl in the 70s and 80s who had to diet all the time. That was a miraculous appetite suppressant. It was 2 different medications, phentermine and phenlaxamine. I forgot the one that was taken off the market because phentermine is still on the market. The second fen of fen-phen was what caused pulmonary hypertension, which was a very rare side effect, but it happened. But again, a rare side effect where still a bunch of people died, enough people that it was taken off the market. And because of the pulmonary hypertension, meaning high blood pressure in your lung system, which is very dangerous, it affects your heart. It is dreadfully dangerous. The difference is the mechanism that worked was suppressing your appetite by essentially changing parts of your vascular system is the best way I can describe it because I'm not an endocrinologist or a pulmonologist. But this is a totally different mechanism. Like this is working on something different in your hormone system. As I say a lot, and I said this about about COVID vaccine, I'll say it about Ozempic. When people are like, "Are you sure it's safe?" My answer is this. I'm not sure anything is 100% safe, just like the car, right?
Right.
I am sure that net for me right now at 54, having had ovarian cancer, I know that if I continue to gain weight as a menopausal woman with a history of cancer, I know the risks that was going to increase for me because I was going to have high blood pressure, my cholesterol was going to go up. I know what that would have done. So it's worth me taking the small chance that there's going to be something that comes out in the next 10 to 20 years. That's not true for everyone. And like, I can't see all well because y'all look small, but you all look so lean and healthy that I don't think any of you probably need Ozempic with the data we have right now. There might be data in the future, pretty near future, when we have enough people on it for long enough, because we've actually been studying it for several years or iterations of it, where we know that even those of us who, let's say, needed 5 to 10 pounds could safely go on small doses of it. I don't think we're there yet. So I wouldn't tell everyone in the world who needs 5 to 10 pounds of weight loss in perimenopause or menopause to go on it because I just don't know the side effects long term. But for someone like me with my history of weight and with my risks, to me, it's worth that small risk that something
Right. It's really personal.
Well, if you have diverticula or diverticulitis, it can be much more risky to take something like that. And I was like, I didn't quite understand the reason behind that.
One connection she might be saying, which is not a direct, it's not like diverticulitis is a reason not to take it, but what it does is slows down your GI tract. It slows the emptying of your stomach, so it makes you feel full faster. But it also, because of that, for some people, the side effect is that everything gets sluggish in their GI tract and they can get constipated. And you might know this, that if you have diverticulosis, you don't want to get constipated because that can trigger diverticulitis. So,
okay, we don't have a lot of time left and we still want to talk some sex questions. And one of them is about as you get older, sex may not be as enjoyable. And I know, this isn't, I'm throwing it to Keira, but it's because we have questions. It's because we have questions.
I have no idea why. I'm in charge of talking about HRT.
Right. And that's why I'm throwing it to Keira because we're going to talk about hormone replacement therapy, which now is called what? What's it called
MHT,
now?
Menopausal Hormone Therapy.
Right.
Menopausal
Hormone Therapy.
I didn't know it had changed.
But
when you were saying Ozempic helps with like lowering cholesterol and things like that, I was told that, estradiol would do some of the things like helping, with heart health. And so maybe you could just talk about, because I know there's also fear around breast cancer and hormone replacement and bioidentical versus whatever the other one is, not bioidentical. I don't really know. So let's dive into that.
Ladies, this is a big topic. I love talking about this because I talk about it all the time.
This is my favorite one.
I'm going to talk. I will talk fast because there's so much to cover and we can't cover it all in our last couple of minutes. This is like a whole nother episode. But in a nutshell, in 2002, there was a study that came out, the WHI study that scared the shit out of everyone because it went on the news and basically said, being on hormone replacement, which is what we called it back then, will increase your risk of breast cancer. And therefore, literally women were taken off their hormones overnight.
Right.
And that's an important historical piece of data to know because it literally made it into the mainstream media. Women got scared. Doctors got scared. They took everyone off. So that was I can't do math. 2002. How many years ago?
22
years ago. Flash forward in the last 3 to 5 years, we have such good data on different formulations slightly of the hormones we used in that study, but we also looked back at that study and recognized the study was misinterpreted and very poorly interpreted. So in fact, people who were on estrogen only, meaning if they'd had a hysterectomy, they don't need to take estrogen and progesterone. They only need estrogen. Those women actually had a lower risk of breast cancer, lower risk than the background risk, right? Mm-hmm. People who were on estrogen and progesterone together had a slightly higher risk, slightly. Like it went up instead of about 10-ish%, it maybe went up to 12-ish%. Like not a lot of women were getting breast cancer, but they were getting breast cancer because, as I always joke, cancer has a really good PR. It scared the shit out of everyone. So everyone decided that breast cancer was the only thing to prevent, therefore take everyone off their hormones, which meant all those women missed out on the opportunity to have the hormones to not only help with hot flashes, night sweats, horrible headaches when your estrogen levels are low, but also improved bone density, which is so important because many more of us will die from a fracture in our hip or our spine than from breast cancer. Mm-hmm. We missed out on the opportunity to have what you're alluding to, the protection of our heart and our brain. right? And so that study really caused a lot of harm because of the way it was designed and because of the way it was interpreted. We were using synthetic hormones, which is in contrast to bioidentical. So when you've heard of Premarin, for example, that like my mom took for years.
My mother did
and
too.
still does at 84. So Premarin was a synthetic hormone. It actually isn't really synthetic because it's from horse's urine, but we call it synthetic.
I'm glad she doesn't know that.
Nowadays, yeah. I know, John. Flash forward to now. We have tons of data. We have a lot of very good supportive evidence that the bioidentical hormones that we prescribe, which are hormones that very closely mimic the ones that are in our system already, we prescribe them as regular doctors. We prescribe them from the regular pharmacy. And that's in contrast to bioidentical hormones that are from compounding pharmacies, which are not FDA approved formulations. They're not covered as far as insurance. So that's the distinction. Like Suzanne Summers used to talk about bioidenticals that were compounded. What most of us as OBGYNs are talking about is bioidenticals from the regular pharmacy.
Because that's insurance, that's covered by insurance, not because it's
covered
better.
by insurance and supported by data.
Oh, okay.
But so let's go forward to, okay, now we talk about bioidentical formulations that absolutely, for sure, we know from all the data, help your bones to prevent osteoporosis. That alone is a game changer for us for our life. We don't like to think about it, right? The 5 of us here are like, oh, we're not thinking about our bones, but we should be, because the work we're doing now with weight training, with things like estrogen can really affect our bones later. And we do not want to die of a hip fracture or a vertebral fracture. So it definitely helps our bones. And it can decrease, for example, colon cancer risk. Plus, it helps all your symptoms. We think from pretty good data that it can also decrease dementia risk and cardiovascular risk. But that is a little bit harder to stake our claim 1,000% because there's some refuting data. So we're still working on it. But again, it probably will help those things. And it can help with hot flashes, night sweats, maybe libido. Progesterone in the bioidentical form absolutely can help your sleep, which you might know is totally disordered when we're menopausal.
Right. How does it help sex, Shieva?
Okay, here's the most important part. Let's assume anyone listening or you guys are like, okay, that sounds great, but it's a lot of information and I'm not ready to take menopausal hormone therapy, meaning the systemic stuff that's going to make me feel better and prevent these things. But my vagina hurts and my vulva hurts when I have sex because it's less elastic than before. And
right,
all I've been told my whole life
dry. That's something that I wanted.
Not dry.
Right, not dry. It's less elastic. Yes.
Yeah, I love when people listen.
Because it's really not about the dryness. It's about that the elasticity is gone. So you're not able to, take in.
Yeah.
See, I'd never heard of that until you, like recently. That
right. Well,
accommodate.
The reason I say
accommodate.
Because if I just say to you guys like, oh, it's dry, then the answer is if it's dry,
use
then
lube.
Just use lube.
Right.
Which how many times have we heard that? Just using lube doesn't often help because again, it's not dry, it's inelastic. You want it to be more like
want to
more
be able to
stretchy and elastic.
expand.
You don't just want it to be slippery. Right.
Stop
If
looking at
something's
me.
dry,
Stop looking over
I'm
here.
sorry, you're just in front of me. I'm not looking at you for any reason.
Right?
We wanted it last.
Right. So
We want to be able to
use the word
accommodate our
dry
partner.
because
She's just doing this.
I just
looking at
need
me.
a partner.
Hey, let her talk. Let her
Right?
talk.
Yeah. So we want to make sure that we are more elastic for them, but more so for us because it's more enjoyable. It won't hurt, less chance of a urinary tract infection. People get UTIs from less elasticity in their vagina and vulva. So if any of you do anything with hormones, there's a long conversation you have to have with your doctor about whether or not you want to use systemic hormones, but there's not a long conversation that you need to have with vaginal or vulvar estrogen. Unfortunately, I should caveat, there are still long conversations because a lot of doctors won't talk about it, but they should.
But is that
It
a
should be
topical
easy.
thing or like a, okay.
It's a topical, meaning it's a
Insert
cream or a vaginal suppository or a tablet or a ring, and you put it into your vagina. And if you use the cream, you also rub it outside on the vulva.
Is
And
that in
then
addition
regularly?
to the hormone or menopause replacement? That's in addition to, is what you're saying.
That's separate from, yes, meaning
Okay.
because let's say you use hormone replacement or menopause hormone therapy,
Yes.
that's systemic, but it's not getting to your vulva and your vagina. So even people who are on hormone replacement often need something vaginal or vulvar.
Oh, interesting.
Many people who can't or don't want to take hormone replacement still can safely use vaginal or vulvar estrogen.
so you
they
have to get
absolutely
that from
should,
you
because if
as
they're
a
having sex,
doctor.
you have to get that from
That's
a
prescription.
doctor or someone who prescribes it. It should be over the counter, but it's not. But you have to use it regularly. It's not a lubricant. We're like, oh,
It's not a, hey, I'm going to
It's
have a
something
hot
you-
date tonight. I'm going to put this ring in.
So you do it like every day?
Right.
Is
It's
it
like
like
this.
an everyday thing?
You do it. Well, it depends. If it's the cream, you use it twice a week. If it's a ring, it stays in all the time. If it's this other suppository, so it depends on the brand and the formulation. It's either every day or twice a week. This is how I liken it. Like when every day we do stuff, different things. I do like 10 different things to try to get my skin to be elastic. But then at night, if I'm going to go out, I might add like an extra zhuzhing, like, something that makes it look oilier, right? So that extra zhuzh is your lubricant you might still need to use, or a vaginal moisturizer you might want to use. But your everyday or a couple of times a week more regular is what you do to make your skin more elastic. That would be like on your skin. I'm assuming you all are using retinol and vitamin C because those are both really good for your skin.
Mm-hmm.
Those are the things you use all the time to make it better. And then just when you're having like when you're about to go out at night, you use something extra. So it's like
Quick
that. And that
question.
is something that is
Sorry.
sad to many of us that the answer has not gotten to you guys broad enough that
Right,
everybody would have access to this.
So if someone has had breast cancer, because a friend of mine has, and sex is very uncomfortable for her.
Yep.
So would you recommend this
Yeah.
product for her?
Yeah.
That would most definitely.
10,000% over. And I am deeply sad that women who have had breast cancer are consistently scared away from vaginal estrogens because we've had this data for years. This is not something new. This is not information that should have been gate kept. We have had decades of information that vaginal estrogens were safe. Now we're talking about it more, but for decades, like I gave it to all my breast cancer patients, but I told them that I needed the blessing of their oncologist just to cover my ass. And most of the time I could get the blessing of their oncologist. But
Well, that is
many of
really
these
good
people are not
news.
being told that. And their vaginas involve us hurt even more because many of them are on the anti-estrogen, the estrogen
right,
blocking medications
right,
like
right.
tamoxifen.
Wow.
And so it's a shame. Like, oh, we're saving you from breast cancer, but now we're basically like making you feel old and decrepit, like you don't need to live any other part of your life for the rest of your life. It's very unfair.
All right. Well, let me ask you this
Okay.
then. So then really what I guess I wanted to clarify is if you are having sex and it is painful, lube is not enough, you need to get one of these products that is not over the counter. You have to talk to your doctor about it, but some sort of vaginal estrogen because lube is not going to create the environment down there that you're hoping for.
If you're having pain during sex and you've been on prolonged birth control pills or you're nursing or you are peri or postmenopausal, which are all low estrogen states, and assuming it's not like pelvic pain in your pelvis, it's actually just pain in the external part when you're having sex, then please go see your doctor and talk about vaginal estrogen or vaginal DHEAS, which is a version of it. But yes,
Okay.
get one of those hormones because that will be really impactful and help you in addition to a vaginal moisturizer and a lubricant.
Does
You
it
might
help
need
with
all of them, just like
UTIs
on my skin.
too? I'm prone to UTIs.
It prevents UTIs, absolutely. And
Oh my
if you have
gosh,
sex
this
now
product
and it's
sounds
inelastic,
amazing.
you will get a UTI potentially, and this prevents that as well.
There was one thing that several women in our audience were asking about that we wanted to address before you go. And that is about grooming. You see a lot of vaginas and vulvas, and we're just curious, like for people who maybe were with someone since the 80s and now it's 2024, like what's happening out there? What are the trends?
That's a great question. Okay. Do you know this? Well, first of all, let's just review. The inside is the vagina, the outside is
Yes.
the vulva.
Yeah.
The only thing you need to clean is the external, just our, when we take a shower, by the way, we need to clean, as I joke, like our pits and our parts, right? Our armpits, because of bacteria and hair, they tend to smell.
Mhm.
And then our external genitalia, meaning our vulva. But
Right.
we don't need to wash anything else with soap. You don't need soap on the rest of your body, by the way.
Right.
Even the rest of your skin, even. You can leave the rest of your skin without soap because the rest of your skin doesn't actually have sweat. If you want to do it, you can, but you don't need to.
Oh.
The external vulva, theoretically, you only need to use water. But I understand that many of us feel a little bit better if we also use some kind of gentle soap. So I would advocate, I am not paid by Dove. I do say Dove should pay me. The only thing I would advocate for in any form of soap so far, unless someone comes out with a better one, is just bar of Dove that is moisturizing only on the external. Do not put it in your vagina,
Right.
but only on the external. The reason I say bar, the bar is cheaper. It's less landfill, better for the environment. And you don't need to buy like all these special body washes or external like
What if
summer
you're just
use
shampoo
or-
up here, shampoo down there? Like, what about that?
Well, shampoo might be a little too harsh for the external
Yeah.
skin down there. So I wouldn't try it.
Depends on what
because
your
you never
grooming
know.
looks like.
Asking for a friend.
I mean,
Yeah.
if it's
Yeah,
80s
now the
grooming, then
grooming-
you might need some shampoo.
Yeah, sure. Now, grooming, I would like to say it's a little bit up to personal preference, and it is. Like, I don't think anyone should be shamed for wanting to be groomed or not wanting to be groomed. But I do think objectively, what I've seen, and there's no
Yeah,
data to
that's what
support
I
this,
want
but
to
in
know.
25
What's
years,
out there right now?
I do think that unfortunately, a lot of young people are fully groomed, meaning bald, which I fully get why that like seems like
They
it would
feel
feel comfortable.
cleaner. Yeah.
Right. Like I joke that when I went through chemo and I was bald as a bat and I had not a hair on me, it was like, oh, that sucks. I don't have eyebrows or eyelashes, but ooh, it felt so nice to just be like completely clean.
Well, and
But
let's be honest,
the truth
sex is nicer. It's just like a smooth
well, but it's not.
path.
Well, but it's not. But it's not because
Okay.
you think it's going to be smooth, but skin rubbing against skin is how you get friction. So not only can it hurt more, think about your little hair follicles actually have oil glands. So they're secreting a little bit of oil, which is good. So what I saw a lot when I was seeing all these gynecology patients in the office was the people who are completely bald, especially who are wearing thongs a lot, especially who are like spinning a lot, their perineum, like that area in between the taint between your vagina and your butt.
Yeah.
That would get so irritated because everything was bald. They had none of their own lubrication from the little oil glands. And the chafing and itching, and not even itching, but the chafing was causing it to get really like thickened and uncomfortable. So they'd come see me and I would be like, are you going to tell me that you're having itching there? And they would say, well, how did you know? Well, I can see it. I could see that over time. So I would advise not to fully groom, not to go completely bald. I would advise to trim as much as you need so that you can comfortably wear your underwear or your bathing suit that you feel comfortable with. I would at least leave like a little, the landing strip or the patch or whatever we want to call it. Because I do think at least on your labia, you need a little bit of hair to secrete some oil. So I think that is what's best.
Fascinating.
Now, that said,
that's interesting.
there's no proof, but it makes sense that we need some of it. And again, the best reason I can support it is that the hair follicles have some oil glands that are going to help lubricate a little bit.
All right.
Okay.
It was good information.
By the way, we didn't even talk about, and that's a whole nother topic, but I hope you all know your anatomy and know what gives you pleasure so that you know how to instruct other people.
I had some questions about vibrators next time.
By the way, the answer is yes about that.
Yes.
Yeah.
But can you get desensitized if you use them?
Yeah. I mean, I think, this is what I say to some of my young patients are like, I can't even have one without a vibrator, they say. And I get that, right? Because it's just so much more effective and more efficient than anything someone can do for us.
Right.
And so I do think it's appropriate to like use one and sometimes use it during sex because you might need to, but also to recognize that maybe you need to purposefully on your own masturbate just with your hands or make sure that he or she is giving you oral sex without a vibrator so that you can still have it reach that threshold without it having to be something really intense.
Right.
Some people can't. Some people, they say they just aren't able to no matter what. And then the answer is, okay, then always use a vibrator, right?
Yeah.
Do you know that people who are like on Prozac, Lexapro, that can really make it harder to have. So that's something to think about in the community.
People with loss, they're having to have that. Well, I have a question. What is the correct pronunciation of clitoris?
Clitoris.
Okay, not clitoris.
Clitoris.
Don't you remember that Seinfeld episode about Dolores?
Yeah.
Dolores?
Yeah.
I don't, but that's hilarious. Okay, I was like, no, dude, it's clitoris. It's clitoris. And he was like, I have always said
And we used to just say the clitoris was like that little nubbin, right?
Yeah.
But do you all know that
it's
we
the
now
whole
know so
thing
much more
underneath?
about that?
That's the tip of the iceberg, right?
Yeah, it goes all the way down the labia and like up into the vagina. And that's new. Like we didn't learn that 25 years ago in medical school. So the nerve endings go down your labia and then back into your vagina where like they kind of talk about the G-spot, that whole top wall of your vagina underneath your bladder. That also has nerve fibers. That whole thing is clitoral nerve fibers.
Wow.
It's not just the little nubbin.
So it shouldn't be that hard to hit then.
There's
Why can't they find
Shouldn't
it?
be that hard to hit.
Why can't
It
they
should not
find
be
it?
that hard. And they still don't know what to do with their big guts, right?
Well, that's why, like you said, and this is a really hard, I think it's an uncomfortable conversation for people, but
You don't need to talk. You just need to show. It's
Just
like
make
show
sure he's
that.
not
You don't
saying
wanna talk.
clitoris.
Show them where
Right.
we could bring you
Yeah,
in.
Start there.
Yeah.
I just say
So-
don't call it anything, just get to know it.
Yeah.
Yes. Oh man, we could talk to you for hours and hours, Shieva. Thank you so much.
Thank you.
Tell
so
everyone,
much.
because this is what's so great about you. You give all of this information freely on Instagram. Share your 2 Instagram accounts.
I love getting to talk about it because I love hearing from you all. And
Yes.
It's like I always say, it's not like selfless. Oh my God. It's like very mutually beneficial because I feel good that like this is the one thing I know a lot about. And I can, and I joke like because I've been through like HPV and ovarian cancer and endometriosis and miscarriages and all of it. I can like empathize because I know our psyche. And so anyway, everyone can find me on Instagram at Dr. Shieva G, which if you notice when it's all together is
So good.
VAG Vag.
Yes.
That just worked
So
out with my
good.
name. And then my online platform with Jenny, my business partner, is Tribe Called V, like vulva or vagina, tribecalledv.com. And right now we have a pregnancy class and a perimenopause class. But in the near future, we will have a much bigger assortment of all the videos about everything we talked about, like HPV, herpes, endometriosis, PCOS, contraception, cancer, perimenopause, menopause, all the stuff.
Yeah,
So-
it's a lot of great information and it's easy to listen to. As you can tell, Sheiva's so great at communicating and she's fun and interesting and gets the knowledge or the information out there. So I encourage everyone to go and follow. You won't regret it and you could spend hours and you'll be so smart at dinner parties and in the bedroom.
And in the bedroom, you'll instruct. All
And
right.
in the
Thank
labor
you all.
delivery
That was
room.
so fun.
Thank you.
Thank you so much, Shieva. We love you.
It's a
We
treat.
Thank
appreciate
you
it.
guys. Thank
Bye.
you. Bye.